Healthcare in our state needs to be fixed. Republicans and Democrats agree on that, but no one seems to agree on just how to do the fixing. Matt King's live, and he's on your side with the story.
Don, the Affordable Care Act's thousands of pages long. Figuring out what it says and what that means for you is really sort of a nightmare. And now that it's apparently here to stay, we take a look at the next decision facing our state's leaders.
What about the health insurance exchange?
That's the #1 question Blue Cross of Idaho says it's fielded since the Supreme Court ruled to uphold Obamacare. But first, a different question. What is a health insurance exchange? Think of it as the marketplace where you go to choose the best coverage for you. I have a paper cut. The exchange lets me choose provider, payment plan, specific services, etc.
Think about it this way. It's a marketplace that would be built by Idahoans for Idahoans.
But that's only if the state constructs its own exchange. Right now, it's a marketplace built by those a nation away for Idahoans. The Gem State spurned $20 million federal dollars to build its own exchange in hopes the Supreme Court might strike down the Affordable Care Act. That didn't happen, so now a choice. Federal or local?
Our needs in Idaho are unique, and our state is unique, so we should have an exchange that's built to meet our needs.
A noble argument, says Representative Jan McGeachin, who chairs Idaho's Health and Welfare Committee, but really a selfish ruse. McGeachin believes state insurance companies just want to retain their stranglehold on this sheltered market.
That's why they are claiming that we should do this in Idaho, because they feel like they might have more control in who plays in these exchanges.
McGeachin, who also owns 3 small businesses, opposes the Affordable Care Act. She says she'd vote against a state-based exchange because the whole thing is, quote, bad policy. At the same time, though, she'd also like to provide more options in the insurance marketplace.
If a federal exchange might open up the market to more competition, then I have to ask the question, what would be wrong with that?
Now, there does exist a third option. Congressman Raul Labrador signed a letter addressed to all 50 governors asking them not to construct state exchanges and instead to gamble on Congress repealing the Affordable Care Act.
Americans want us to.
I also spoke with a doctor today who said he strongly favored a state-based exchange. He felt it would better tailor care to Idahoans and engage our state in building something uniquely its own. In a statement today, the governor told us the issue was complicated. He remained open to all options and planned to explore all of those options further before reaching a decision. Live in studio, Matt King, Today 6 on your side.